Hi, good morning or afternoon. I hope everyone's doing well. My name is Cianya Paulina Aguila, and today I will be presenting for everyone the Senior Medication Safety Project. This project focuses on the geriatric population. As a nurse, I have enjoyed and I have intrigued me the geriatric population because I believe this population is fragile and it has many challenges that often they get overlooked. And one of the challenges that I believe that these patients have encountered is the administration, management, and organization of the medications or their prescriptions and at home, in a home setting. So the Senior Medication Safety Project has a clear message and a clear topic. Medications, elderly individuals at home. This project focused on educating the geriatric population on how to safely manage their medications at home and reduce the risk of harmful incidents. Many of these patients or the geriatric patients, elderly patients, live at home either by themselves or with a family member or with a caregiver, or they only assist them as needed. But most of these patients tend to live at home by themselves. So the issue is how these patients can manage, can organize, and can administer their own medication safely. Many of the geriatric population, it's patients that have more than 3 or 5 medications due to multi-morbidity and multi illnesses and diseases that they have that they need to take medications. So the problem is how they manage all these medications by themselves. Are they educated? Do they know what are their medications for? What are the adverse effects, side effects? How to take their medications? When to take their medications? When not to take their medications? What they need to check before taking medications and when they're taking medications. So, um, education it's a key for for this process for these patients to understand and look for, and not only the patients, the family and the caregivers who are involved in the administration organization should know everything about the medications, how to administer it, what to do in case a harmful incident happen. We need to educate these three individuals. This project focused on the geriatric population. The geriatric population has been considered the most fragile individuals from other age populations. It has been estimated that 703 million people are currently older than 65 years old worldwide. The geriatric population has specific needs according to their age and their necessities, and these needs can be addressed by social services, case management or care management, health care, home care, long term care, special needs, education, and management for the aging process. These individuals, or the geriatric individuals and population, are the ones who need more assistance and more care and more education from any age group. So we're going to talk about the geriatric demographics. It's been estimated that Americans that are 65 years older, they're nearly going to double, 52 million in 2018 and 95 million by 2060. And the 65 and older age group share a total population with a rise from 16% to 23%. So these individuals, this population, are increasing their numbers. The increase in the older population can increase their ethnic, racial, and gender diversity. It's been estimated that 14.7 million of older people are living alone in the United States. A higher percentage of older women live alone versus men who lives alone. So it's been estimated that 14.7 million of elderly individuals live at home alone. And the woman, it's the one who has the prominent numbers that live at home alone. Their life expectancy of the older population can average from 78.6 years. Medicare and Social Security have experienced an increase in their expenditures. So since everything makes sense, is everything they're living longer and they're requiring more health. That's why Medicare and Social Security have seen an increase on their services. Every year, there's more geriatric individuals that need healthcare assistance, retirement, and it rise geriatric population growing. So we can see in this next, we can see here in the geriatric population statistics how this population has been rising throughout throughout recent years. We have the 1900s, 1950, 2000s, and 2050. And we're going to focus here on 65 years and older. So in 1900s, it was 3.2%. 1950 was 4.9%. 2000s was 12.6%. And it's estimated by 2050 that this is going to increase by 23.7%. So we have seen this increase in the geriatric individuals, and in this other slide, in this other, we have here the trend of the different geriatric individuals around the world in Europe, North America, Latin American, Caribbean, Asia, East and North Africa, and Sub-Saharan. So we can see here that how these individuals have been increasing, not just in the United States, but throughout the world. The increase in the elder population can increase their ethnic and racial and gender diversity, like I mentioned. And these individuals, they just keep on living longer. The geriatric community. The geriatric community, it's a community that that needs a lot of resources. Here I have explained the advantages and disadvantages of the geriatric community. So their advantages is that they are socializing with other geriatric people and family, that this is good for them, for their self-esteem, and prevents depression. Multiple assistance programs. These individuals tend to need assistance programs for their daily activities or their daily living. Sorry. Active living, health assistance, quality of care, quality of life. For the geriatric individuals, it's really important to have quality of care and quality of life. Disadvantages on the geriatric community, it's living alone, family separation, anxiety, depression. All these factors can attribute to many other problems. Refuse assistance. Many of these individuals they have their set ways, and it's hard for them to ask for assistance or to admit that they need assistance on stuff or activities that they normally do, or people normally do by themselves. Health issues and multiple illnesses. These geriatric individuals tend to have many health issues and multiple illnesses. Financial health issues is another thing. Sometimes they're Medicare, Medicaid, Social Security. They have problems with that. They don't have financial means to attend to their illnesses, to their health, and inadequate care and life. And all this can be attributed sometimes as a refuse of the assistance. It's one of the communities that need special attention when it comes to healthcare, health necessities, support, assistance, activities, education, care quality more than quality. Care quality, sorry, more than quantity. So for these individuals, we want more quality than quantity. Okay, and then we're gonna medication education is essential. In my opinion, the geriatric population needs education, needs to be fed of education in order for them to be safe. And it's not just the need of education, or is the reinforcement of education. Because sometimes you can explain to these patients essential stuff or components, but they get forgetful. And it's our job as medical professionals to maintain education and reinforce and explain one time, two times, three times um, things to these patients. Education is an essential component of my safety education project, medication project for these people. Uh, Patient and medical providers need to have open communication, relationship, feedback is being receptive. It's really important to have an open relationship and a communication with our patients, especially the directed individuals, so we can help them and assist them in anything they need. Patient need help in management of their medications. Storage organization, expiration dates, medication list update, medication education, like side effects, adverse effects, all this process of the medication administration and organization needs education and reinforcement from medical professionals. We're gonna see here the directed epidemiology. So these individuals, the directed individuals, tend to have polypharmacy. They take more than 5 medications, and it's not only prescribed medications. It's over-the-counter medications. And all these medications have risk factors that contribute to the inappropriate use of medications are bone fractures, injuries from falls, from like I mentioned, bone fractures, um, disability, urinary incontinence, diabetes type 2, cardiovascular disease, and cognitive deficiency. All these factors, all these contribute to inappropriate use of medications and can be harmful for these patients. So many of the geriatric individuals take more than 5 medications, and it's part of the aging process. Geriatric leading mortality disease in 2020. We can see here that diseases of the heart, it's on the top. Malignant neoplasms, it's second. COVID-19. Now, I'm surprised it's not the leading one, but at some point it was the leading cause of mortality. And cardiovascular diseases, and 4, Alzheimer's diseases. So we have here diabetes in number 7, accidents or injuries, unintentional injuries on 8. And these accidents and unintentional injuries is mainly our population or geriatric individuals that live at home. And we're gonna see geriatric comorbidities. Geriatric comorbidities, medical prevalence in comorbidities most are reported by geriatric individuals is hypertension. So the mainly comorbidity in the geriatric individuals is hypertension. And we have here that hypertension, it's in 58%. Um, Many geriatric individuals have chronic conditions that attribute to the causes of death and the use of many medications, in which they encounter side effects that can be causes of acute and chronic medical conditions, can end up in death. Chronic disease self-management program helps, helps geriatric individuals develop the necessary skills and self-manage and control their current conditions. The program includes workshops that are interactive and educational. So we have here the chronic disease self-management program, and this program helps geriatric individuals manage their chronic diseases. So like I mentioned, hypertension is number one, high cholesterol number two, arthritis we have 31%, and we have heart disease 29, diabetes in 27%, chronic kidney disease is 18%, heart failure 14%, depression 14%, Alzheimer's 11, and COPD, chronic obstructive pulmonary disease, in 11%. So hypertension, high cholesterol are the top leading comorbidities that geriatric populations have. And it's important to mention and to educate patients regarding the National Suicide Prevention Lifeline, and to encourage these patients, if they feel depressed, if they feel any type of risk or any type of suicidal ideations or plannings, to reach out, or us as a medical professionals help these patients. So here we have the geriatric top leading causes of death in 2020. So in here we can see that in our geriatric individuals or geriatric population, our causes of death, the first one is falls. The second one, poisoning, drug overdose, choking, flames, or smoke. So our leading cause of death are falls. And falls, most of the falls that geriatric individuals have is medication related. Maybe medications that make them dizzy, make them drowsy, and sometimes some adverse effects or side effects of medications. The second is poisoning, drug overdose. This happens with they don't manage their medications properly, or they don't know how to manage their medications properly. So we can see here that falls and poisoning, it's related to medication administration and organization, and it's mainly on individuals, geriatric populations that live at home. Next, we're gonna address the risk falls related to medications. We can say that falls are the leading cause of death in geriatric individuals. Medications are one of the leading causes of falls in the geriatric individuals. Many geriatric individuals use more than 3 classes of medications in their lifetime. So medications, falls are really high risk. Here we have our medication dash fall risk score that we can apply and use to determine the fall risk score for each patient. And we can see here that in our high priority, we have medications that patients use, at least one class of medications that the patients use, or sometimes they use 3 or 4 classes of medications. And we have the potential side effects that that some of the patients experience, and that's why falls happen, and that's why harmful incidents happen, and even deaths. So one potential side effect that we have on high class is sedation, dizziness, postural disturbances, altered gait, and balance, impaired cognition. So all these side effects attribute to falls and to harmful incidents. On a medium class, we have induced orthostatus, confusion, poor health status. On a low one, we have increased ambulation and induced orthostatus. So these patients tend to be on a high fall risk, and most of the patients take one or more of this class of medications. So that's why we need education. That's why we need to educate and teach our patients about medication, so we can reduce the fall risk on the geriatric individuals. Monitoring can prevent injury and death. We're gonna go back to education. Education is the key to monitor and prevent. Many of the geriatric individuals self-medicate. Why? Because we have so many over-the-counter medications that they don't need a prescription, or they don't need an advice, or they don't need a medical professional to give it to them, or they can just go to the store and buy the medication. And sometimes geriatric individuals take medications that they don't even need. So this action needs to stop. Why? Because it's causing harm, or it can cause harm with harmful incidents, and place them at risk. It's a safety risk, and they need to manage. We need to educate our individuals how to manage their medications. If I have diabetes and I take insulin, I need to learn how to use the glucometer, how to properly use the machine, and every machine is different. So we need to educate the patients on the machine that they are gonna use at home, because why we're sometimes we educate the geriatric populations how to take the blood pressure, how to check their blood sugar, and we teach them or we educate them with our machines, instead of like, okay, which machine are you gonna use at home, so we can practice and I can teach you on the machine that you actually gonna use and take home. So we're gonna go back to education. Education is key. It's key. It's key. Cultural neurodiversity. Geriatric individuals have cultural practices that they have practiced their entire life for the most part. Cultural neurodiversity refers to the elderly individual's diversity and different cultural practices, preferences, traditions, and behaviors that each individual practice. Nowadays, diversity is an open topic that many people embraces on their everyday living. So cultural diversity, it's something that it's a topic that medical professionals have to have in mind when we take care of the geriatric population. Race and ethnicity in El Paso, Texas. Okay, El Paso, Texas. El Paso, Texas is a Hispanic driven culture. Many geriatric individuals have suffered many discriminatory experiences due to not speaking or understanding English, because they're Hispanic, and their Hispanic cultures, some geriatric individuals don't even know English. So we can see here, white Hispanic has the most consensus, has the most percentage. In El Paso, Texas, the Hispanic population has a significant impact on the healthcare system and care delivery, especially in the geriatric population. In 2019, the Hispanic population aged 65 and older is the largest racial ethnic minority group in this age cohort. So, Hispanics. This heavy Hispanic influence is in the city has created many challenges in the healthcare system and the delivery and application of medical professionals in El Paso. So we can see here white Hispanic, other Hispanic, white, non-Hispanic are the three leading um, ethnicity and that is in El Paso, Texas. Geriatric care services. Geriatric care services or geriatric centers that encourage and multicultural environment and inclusivity among their community. It's important for the geriatric population. Um, many geriatric centers prefer people with different cultural backgrounds, cultural preferences, but there's some centers that they don't encourage or they don't welcome cultural practices or cultural preferences, not practices, preferences from the geriatric individuals. I have found this geriatric care service. It's called Multicultural Elderly Care Center, and this center specialized or has a objective of the Center for Excellence for the elderly community. They services with various multicultural classes, home care support, housing benefits, surgery, and assistance services. Can help many geriatric individuals feel welcome. The older people in the healthcare have the same options as any other individual to determine how and what they want to do in their healthcare treatments, including their cultural preferences and practices. Like I mentioned, centers that welcomes and opens cultural diversity and makes geriatric individuals feel um, welcome and feel safe to express their beliefs and their preferences. It's an optimal and it's something that the healthcare system and medical professionals we need to take in consideration. Each geriatric individual can choose identities or personalities such as being a member of an association, part of a professional group, religious affiliation, practice, and belief, any religion they choose. Diversity, diversity, diversity. Next, we're going to talk about the elements of a cultural competence. The elements that characterize geriatric diversity are ethnicity, race, gender, language, economic status, sexual orientation, physical ability, education, spirituality, and religion. So these elements are what makes the cultural diversity and competence. These elements play an essential part in the healthcare and well-being of the geriatric population. Like I mentioned, they feel welcome and they feel accepted with their practices and beliefs. Geriatric individuals choose some identities or personalities, such as being a member of an association, like the association that I had shown previously, part of a professional group, participating in any religious affiliation. For example, many geriatric individuals that practice or they are Catholic, they go to church and they practice Catholic practices and religion, and by going to church and spend time with other people. Culturally diverse geriatric individuals can be more open to dialogue and have better communication skills with people with different cultures and customs, making them more diverse and open to their healthcare. When the geriatric individuals feel and feel safe and feel open to other cultures, um, they can be more receptive to their healthcare. And here I have this tab with 5 elements of cultural competence. And first, acknowledge the cultural differences. We need to acknowledge the cultural differences of our patient, of the individual that we're taking care of. Second, we need to understand their culture. Third, we need to engage in self-assessment. Fourth, we need to acquire cultural knowledge and skills. And fifth, view behavior with a cultural context. These 5 elements of cultural competence are essential and are really important for medical professionals to take in consideration when they take care of geriatric individuals, and not only geriatric individuals who take care of a patient, of a person with different culture views or culture practices that that um that are different from the medical professional. We need to take care in consideration these points, and encourage and respect their cultural practices and preferences. The composition of the elements are fundamental for the development of the cultural diversity. Communication in geodiversity. This is really important. Communication patient relationship is important for medical professionals to establish trust and bond with a patient. It is important that we establish a trust and a bond with our geriatric patients. Geriatric individuals tend to be more particular and systematic on their lifestyles, on their choices, and especially on those of their religion practices. We need to respect cultural practices um, that can help build and communicate relationship with the geriatric individuals. So we need to consider and be respectful of their cultural preferences. Like I mentioned, communication is key to having an optimal culturally diverse relationship between medical professionals, communities, organizations, individuals, families, and practice and patients. So communication with the whole environment, it's a key. It is essential to achieve cultural competence in the geriatric population to evaluate the aptitude and establish behavior, cognitive and affective skills to help understand the geriatric culture and achieve appropriate communication. So we need to the 5 points that I have mentioned, the cultural competence. It's important for us to have it in mind and to respect them as much as we can, or follow them as much as we can, so we can establish that communication patient relationship. In the healthcare, it is essential to consider the different types of patients and their cultural background. This can affect the patient relationship and communication among the medical professionals and the healthcare team system and the healthcare team. So we need to keep in mind that that respecting the culture and the practices of the geriatric individuals can help bond and can help the communication patient relationship. Sorry. Next, we're gonna discuss the senior medication safety project and the evidence-based practice. Sorry. And the evidence-based practice. Okay, what is the evidence-based practice? So the evidence-based practice on this project is how education is gonna help or is helping the geriatric individuals that live at home manage and organize their medications effectively, and how can we decrease the risk factors and harmful incidents for these patients. How does the we need to look into what evidence research have shown regarding the management in the elderly, regarding the medication management in the elderly. So EBP is a clinical expertise, patient values and circumstances, and what is our best research evidence that's gonna help us with the evidence-based practice. Um, we're gonna take in consideration patient, family, caregivers, medical professionals, medication information, education information, and programs that are available, and how patients are receptive of these programs and these educational tools that can help them. The problem. What's the problem? The problem is inappropriate management, use, organization, information of medications that the geriatric individuals um, is prescribed or uses daily at home. So our issue is how inappropriate their management, use, and organization of their medications is affecting the geriatric individual who lives at home. What type of education in the elderly patient is getting regarding their medications from the medical professionals. So we need to take in consideration how what type of education medical professionals are giving to the patient, and not just what type of information, how they are giving this information and this education, how they are applying this and helping the patient, and if the patient is really understanding the education and the information that is given to them. Education in medication management and organization to the geriatric individual is one of the least educated topics that medical professionals and healthcare providers address with the elderly patient. So, without say any other words, education in medication management, and especially patients that live at home, is the least educated topic that is given to these patients from the medical professionals. Geriatric individuals that live at home and manage their medications need different type of education compared to patients that live in a assist living or live in a skilled nursing facility who has someone who has a medical professional like a nurse who administers and organize and manage their medications. One problem, a big problem, why these patients inquire into risk and harmful incidents is polypharmacy. They're polymedicated. Um, they have multimorbidity, acute and chronic illnesses and diseases. All these are medications and medications and medications. Polypharmacy is more than 5 medications, and most of these patients take more than 5 medications. Polymedicated, this can be due to the over-the-counter medications that are available for them to take, and they have multiple acute or chronic illnesses or diseases that they need to take more medications. Another problem is inappropriate management and use of medicines that can lead to risk and harmful incidents and even death. Everything goes back to inappropriate management, risk, harmful incidents, even death, is for lack of education and from lack of medical professionals and health and the healthcare system to follow up and to educate and not just educate, teach, and show them how to manage their medications. Geriatric circumstances in the use of medications. Like I mentioned, we're gonna go back to our two leading um, circumstances that geriatric individuals use medication is polypharmacy. They use more than five medications. Why these patients use more than five medications? Because over-the-counter medicines. There's plenty over-the-counter medication that is available for them to have without any prescription. Side effects that create more illnesses and diseases. Why more side effects that create that? Because they have their prescribed medications and they have the over-the-counter medications, and we haven't even mentioned it's not just the prescribed medications or the over-the-counter medications. Is herbal supplements or teas or remedies, and especially in the Hispanic culture, they're prone to like, oh, your stomach aches, and oh, take this tea or take this supplement or oh, this remedy. So can contribute to side effects or to adverse effects from medications that they are taking from other that they are prescribed and they're currently taking for other illnesses, acute and chronic illnesses, medication errors, and the use of more than one physician. This in particularly, it's one problem that that many geriatric individuals have, that they have multiple physicians for different types of illnesses that they have, and sometimes these physicians they don't communicate with each other, or at least they don't communicate with their primary physician. So at times we have patients that the primary physician prescribes something, and then if they have the orthopedic pain management physician, um, uh, um, uh, uh, other specialty physician that they need, and they prescribe more medications. Sometimes they don't communicate among each other, and the patient ends up taking medications, and they don't even know if one medication can react to the other medication. Can you even take medications, this medicine with this other medicine? So it's a problem there that we need to explain to the patient, to the geriatric individual, that they need to be aware, and they need to be communicate with their physicians. Polymedicated. Patients, we have topics like acute and chronic illnesses, 5 or more medications a day. It's attributed to multimorbidity, multipathological medication errors, and the use of more than one physician. So polypharmacy and polymedicated have the same point, kind of the same points. But these two are the leading topics, the leading causes of why these patients take so many medications, and why they cannot effectively manage and organize their medications at home by themselves. Evidence on inappropriate use and mismanagement of medications at home. Inappropriate use of medications due to the increase in the geriatric population, the multimorbidity or chronic and acute diseases, are the incidence on polypharmacy and polymedicated patients that are multipathological. We have here that the high incidence among the geriatric population. Factors like I mentioned, polymedicated, polypharmacy, multimorbidity, and multipathological um, can contribute to inappropriate use of medications, non-adherence in the medication treatment. Most of our geriatric individuals have this problem. They don't adherence to their medications treatments. Sometimes they take their medications, sometimes they don't take the medications. So it fluctuates how they take medications and when they take medications. Over the counter medications, harmful incidents like overdose, poisoning, and falls. Incidents like falls, delirium, hallucinations, drug interactions, hospitalizations, and increased healthcare costs. So, inappropriate use of medication management at home has all this evidence and those is issues um, or these factors that can affect the inappropriate use and management of the medications at home. And whenever we have all these incidents and all these risks and all can increase the healthcare cost, not just for the patient but for the whole healthcare system. Evidence in medication information and education. So we have I have research and for what I have read and research regarding this topic regarding the medications at home. It's important to take in consideration many factors that can help that are educational tools and information that can help the patient. Maybe these educational tools and information will help one patient, but maybe the other one will not help him because every patient is different. Every patient understands differently. Every patient learns differently. So we need to have appropriate literature. We need to take in consideration language barriers and tone, how we're gonna talk to the patient, and if they speak English, if they speak Spanish, if they speak another language, what type of information we're gonna use, either written or explained, the format of the presentation, either gonna be really engaging into the presentation, and I hope you guys are engaged into the my presentation. um, Effective communication, the use of medical and non-medical gadgets. Uh, like I mentioned before, we need to educate and explain them on how to use the glucometer, how to use a blood pressure machine, and especially their own. We need to take in consideration the primary care professionals, the general medical professionals, how they're gonna deliver and how they're delivering this education and information to the patients, and they're either really uh, making sure that the patient is understanding the educational and the tools that they're giving. Any patient safety concerns, patient medication knowledge, questions of doubts. Sorry, this is really important. Medical professionals need to assess and take in consideration the medication knowledge, questions, and doubts that the patient may have. Or sometimes patients they don't like to admit that they didn't understand or they don't need more information or more help. But it's our job to determine if they really need more information or more teaching. In, this can increase the healthcare cost because of the programs and the multiple factors and implications that are in the process of education and teaching, and more research in medication education, tools and gadgets that the elderly individual needs. So this one is an important too. We need to, like I mentioned, we need to do an assessment, and it's not only the patient. We need to take in consideration if the patient, the geriatric individual, lives at home and a family member or a caregiver helps the patient with with the medication administration, organization, and storage. We need to educate them as well. Evidence practice on inappropriate use, organization, and mismanagement of medications. Inappropriate use and mismanagement can lead to high cost and burden to medical healthcare system. If we don't educate our patients and we don't try to correct or address any issues or any doubts, this can be high can cause high cost in the medical healthcare system. Medical professionals and healthcare providers need to evaluate the knowledge of the geriatric individual regarding the medication that they take. Lack of enough and appropriate questions are being asked to the patient, family, or caregiver. Like I mentioned, we need to evaluate, we need to do an assessment to see what is their base knowledge, why they know before us, um, educate them or teaching them. We need to assess them and see what is the level of knowledge that they have regarding the medications and the medications that they take or they help administer. And with that, we can set up our base on in which level we need to start our education or our uh, teaching. It's important to establish who is managing and administrating the medications. Like I mentioned, many of geriatric individuals that live at home, they have a family member or a caregiver that helps them in the delivery of the medications and the administration of the medications and organization. So we need to establish who plays what role, or if they help each other to educate effectively and appropriately. Internet, social media, blogs, websites, pharmaceutical associations, and industries can offer the patient the wrong and incomplete information. This we can go into misinformation, medical misinformation. Nowadays, with the advancements of technology and how technology it's run everyone's life, we cannot live without a phone, and we're always in an internet and in applications. Many of misinformation, or many websites have misinformation, especially on medications. So we need to explain to the patient and take in consideration that when they research or when they search for a medication and it's a process, it has to be from trustworthy and from healthcare websites that can offer them accurate medication information. Patient medical appointments are short in time, and quality limits the patient to ask questions. Clear doubts reinforce the information and education that has been provided. Patient would state that everything is fine and understanding even though they didn't understand. This creates problems due to the patient seeking information from untrusted sources, limited or incomplete information. This process, patient medication appointments, is really important. Uh, Sometimes our patients, when you teach something, you explain to them something, or give them information as a medical professional regarding any issue or any illness or disease, uh, or procedures or process. Patients don't like to admit that they didn't understand. They don't like to admit that, oh, you know what, I didn't understand, or it wasn't clear. Sometimes they just say, oh, okay, okay, I understand. Oh, okay, and they didn't. So they go to resources like we mentioned in the prior point, untrustworthy websites or websites with misinformation, and it's when the patients get the wrong idea or get the wrong information regarding their medical or healthcare question that they have. Assessment, planning, interventions, and evaluations are important steps to increase knowledge in patient and decrease medication incidence. So, like I had mentioned, medical professionals, they need to assess, implement, intervene, and evaluate. Um, we need to what we are educating, what are we teaching, how are we teaching it, is the patient understanding, is the family member understanding, is the caregiver understanding, are they both understanding, is everyone understanding what I'm trying to say, are they receptive of what information I'm giving. So medical professionals need to pay more attention and take in consideration these points. Education and formats that the presentation have or that it's been presented and delivered can affect the effectiveness in the understanding of the education. Not all the patients understand, or all the patients are teach the same. Uh, some patients can be more verbal, verbal understanding, visual understanding, didactic understanding. So we need to assess as well how we're going to deliver our education. Further study is in need to continue evaluating the education process on the elderly individual who lives at home. Um, for what I research and what I have found, education is one of the primary evidence-based practice that has shown and that have has addressed the patient's inappropriate use of the medications, but it's a topic that still needs research. It's a topic that still needs evaluation, still needs applications, still needs adjustments and programs to help educate these patients and help them decrease any risk and any harmful incidents that they may have. Listening and educating. Listening and educating. These two actions can help prevent and decrease medication errors, inappropriate use of medications, effective management and organization of medications. It's really important to listen and educate. This can help when we listen and we educate. We can formulate assessments, planning, interventions, and evaluation in the use of medications and treatments. So um, we need to listen and we need to educate our patients. The Senior Medication Safety Project Plan of Care and Outcomes. It is crucial to create a care plan with a framework that includes the assessment, diagnosis, planning, implementation, evaluation, and outcomes that are short and long term goals that can help alleviate and reduce the harmful risk that the medication administration, medication management, and medication organization has in the geriatric population. The assessment. The assessment, geriatric, we need to take in consideration geriatric education from medical professionals and healthcare workers. The lack of education due to not having enough time in medical visits, failure to do an adequate assessment, not enough medication education programs available for the geriatric population. Factors that can prevent effective education in the elderly, like medication adherence, level of knowledge that the geriatric individual has, and the objective data and subjective data that are essential to assess the medication education. Assessment is fundamental. For us for this project, assessment is what's gonna determine the course of the program and of the project. And we need we need to evaluate, assess the healthcare providers, how they're delivering the education. We need to assess the lack of education. We need to assess if there's not enough education. We need to assess the factors that can prevent, the level of knowledge, and the objective and subjective data. Um, with the assessment, hopefully we can have a platform, we can have a plan, we can have a base on how to educate these patients, and we can prevent the risk factors or harmful incidents like overdose, falls, adverse adverse effects of medication, um, and this can decrease hospitalizations and death. Planning. The planning, medical professionals like physicians and nurses have an important contribution to the potential programs in medication education that will depend on the skills and knowledge that the patient can acquire during the medical appointments and home visits in the educational programs. So educational programs, it's important in the planning. What educational programs are available for this patient? How can we help them connect to these educational programs? Um, what formats those these educational programs have that's gonna help the patient? Quality and time in the education delivered on the medical appointments, home visits, and educational programs. The time, the quality and the time, it's important too in education. Evaluate the elderly knowledge by assessment, plan, implement, and evaluate. We're gonna go back to the same point, and the points are repetitive because it's the base, or it's the pattern that we need to follow in order to educate these the geriatric individuals. Educational types of delivery, like I mentioned, it can be information that can be verbal, written, visual, and what types of information. Um, it's the information in their language that they understand. Is the information not enough? Is the information in a language that they can comprehend? Not only that they can understand, that they can comprehend. Um, these are factors, and these are things that they need to take in that we need to take in consideration when educating our geriatric individuals in the use of medications and management and medications, and organize their medications at home. The outcomes. What outcomes uh, are expected? Um, we need to deliver accurate and adequate medication information. This is one of the main outcomes: the delivery of information that has to be accurate and adequate. Um, Open communication with feedback. It's important for medical professionals to have a patient relationship with an open communication, that they can provide feedback, so we can continue adjusting and changing strategies if necessary. The will participate and ask questions that can help clear any doubts. We need to encourage our patients as much as we can when we're educating them or teaching, that if they have any questions, like if they have any doubts, if the teaching wasn't clear, do they need us to repeat again? We need to make them feel comfortable so they can ask. The patient will report any issues with the educational process and the understanding of the topics that are being discussed. Like I said, open communication, so they can let you know if they understand or they didn't understand. Information, the delivery of information can be throughout a verbal or reading explanation that can be clear and understandable. Open communication again, information, verbal, written, visual, the language. Education can be delivered to the patient or caregivers. Demonstrations of effective medication management of their medications at home. This is gonna be that really important that the patient adheres to their medication regimen and practices. So the outcomes are are important for this project. The short and long-term goals. What are our goals on this project? Um, the short-term goals is educate the geriatric individual on the use of their medications at home. The patient will understand the medications that they're taking and why they're taking them, and how can they identify and monitor any adverse effects, side effects, and any medication interactions. Appropriate medication management, use, and medication organization at home. One of our goals is for the patient to achieve a good medication management and organization in their home setting. And a mainly goal is to achieve a patient safety and medication safety. That this is our golden ticket. This is what our primary goal is for the patient medication safety project, is for the patient to be safe and have safety in their medications. Long-term goals, we have create more educational programs, more programs that can target the geriatric population and educate them, especially in the use of medications at home. So this is one of um, our main long-term goals. Home educational programs. There's not many home educational programs for these patients. Their educational programs basically are people or nurses who call the patients and ask them about their medications if they have any questions, but it's just a phone call educational program. So we need more one-to-one teaching programs that can be interactive, and that can we show and be more visual, educational programs that are visual to the patient. Education to the patient, family, and caregivers that are involved in the patient care. It's important to involve everyone into these programs. Everyone that is involved in the patient care and the patient medication administration at home, and decrease many harmful incidents and deaths. Uh, we need to decrease and as much as we can this point. Implementation. What we're gonna implement in the medication safety project. Um, the patient educational process in the inappropriate medication use, in organization, and mismanagement. So we're gonna address these issues. Educational programs. We need more educational programs. Establish and assessing the education procedures and tactics to use. It's part of our assessment. Understanding the information, literature, and in services. This is part of our evaluation phase. How the patient understand the teaching and the education. Assessment must include the capacities and the cognitive level of the person to understand the education. This point is really important because not all, but some of the elderly people have chronic conditions like dementia, Alzheimer's, um, and they get forgetful. Besides having those issues, uh, elderly people can get forgetful. If I get forgetful, uh, they get forgetful at times. So it is really important when we do our assessment to assess their cognitive level and their capacities. we need to assess how we're gonna deliver that education to the capacity that the patient has, because maybe the patient, we will educate the patient, but the patient capacity level or cognitive level will not understand what is being taught. So we need to take in consideration this point. Medical professionals can educate and reinforce the use of medications at home. So this is really important to continue reinforcing uh, and reinforcing the education of their medications at home. Every individual will be treated differently according to their knowledge, language, intellectual level, and the type of education tactics that best fit them. So we need assessment, and we need to take in consideration the assessment, and so we can deliver the education. The format and type of the narrative are important for understanding of the topics. Uh, we need to make sure that the patient understands the language, the tone, and if it's not too technical, too medical technical, that it's more on a level that they are word, or the wording it's on a level that they can understand. The use of tools like the pill dispensers, medication lists, medication organizers, organizational binders, memory tricks like the relationship of the pills, like the times, the lunch, breakfast, dinner, when to take the medicine before with meals. Um, we need to correlate medication times with lunch, breakfast, and dinner. This can be helpful tools for the patient. So we need to take in consideration how the patient, what the patient is using to stay on top of their medications, administration times. Are there medications organizers, like either taking each pill from the bottle every time, or they have a pill organizer, or they have a list that can help you remember. So this is a good topic, and this is a good tool that we need to take in consideration, and we need to take in consideration too the family and the caregiver, if they have one. We need either helping with the administration, with the medication administration. We need to include them in the teaching and the teaching and educational services plan. Quality and safety education for nurses. Uh, Quality and safety education for nurses is an essential component in the nursing practice in order to deliver a safe, quality, and optimal patient care. It's important that we take in consideration the knowledge and skills that are necessary to deliver quality and safe patient care. Components of effective quality and safe education for nurses. We have three components: knowledge, skills, and attitudes. In order to achieve effective quality and safe education for nurses, it's essential to assess and evaluate the nurse's knowledge, skills, and attitudes towards the patient care and the nursing practice. So improvement of their components are the constant evaluation in the future nurses and the professional nurses. So in order for a nurse to deliver effective patient care or nursing care, we need to have knowledge, we need to have skills, and we need to have attitudes that can help us deliver safe and quality patient care. Focus areas on competencies in quality and safe education for nurses. It is important for the nurses to be competent on these points, on these areas. Safety, it's the first one. Safety can decrease the risk of or harm. Safety practices, competencies can help nurses deliver safety patient care and safety medical care. The second one is informatics. Informatics, nurses need to be equipped to use technology, communication, and limit error and decision marker support. So they need to be aware, and they need to have the knowledge to use any informatic in their practice. The third one is collaboration and teamwork. Nurses need to be open to collaborate and work as a teamwork in order to deliver patient care, and to deliver not just patient care, to deliver a safe and 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 a good and quality care for the patient. Open communication with peers and interdisciplinary team and medical professionals is really important for the patient treatment and for the patient health. Patient centered care, uh, nurses need to advocate, and they need to have advocacy in their patient needs, in their values, and their preferences. They need to center their actions, their knowledge, their skills, their attitude towards the patient and the patient care. Quality improvement. Quality improvement, this is important because it's part of the delivery of patient care. It's how the methods and how to monitor the outcomes, the process, and any changes that are needed. And if they need that they need more improvement, or that they need changes. So quality improvement, it has to be a constant point to be reviewed, and when delivering patient healthcare. And the last one is evidence-based practice, and this is evidence-based practice. It's what nurses and the medical health and the healthcare professionals based their practices and their procedures. Um, we need to always practice the current and best evidence in patient care that the clinical expertise has or have. So we need to always deliver the best evidence-based practice uh, uh, process and procedures and healthcare to our patients. These areas, all these points, um, they are in need to be practicing quality and safe standards to deliver patient care. Um, these focus areas are part of our knowledge, skills, and attitudes that a nurse has to have in quality. Nursing educational components. Uh, it's so vital that nurses never really stop learning and developing their competencies. So nurses never, and not just nurses, medical professionals never stop learning and never stop developing their skills and their knowledge and their attitudes. Why? Because medicine keeps evolving every day. Every day there's new research. Every day there's new outcomes. Every day there's new things that changes the practice and how medicine and is practiced. So we need to have knowledge. Knowledge is a lifelong process. Knowledge, we're never gonna stop acquiring knowledge and learning. Process, we always have to have in mind, especially nurses, that we need to assess, plan. We need to assess, do assessments, planning, implementations, and evaluations um, to determine patient needs and patient healthcare values. The traits for advocate patient care. We always have to conduct ourselves and direct the nursing practices and profession with values of care, of patient care. And the roles, nursing job description and duties and degrees. We always need to be attend, and we always need to have in mind our roles. What are our roles in as a nurse? What the nurse is going to do as a provider of care, what the nurse is going to practice, like administration of medications, IV insertion. Like, we need to be aware of our roles. Elements in nursing competencies. Um, these elements are in the every in the nursing practice, in the nursing professional. Elements in nursing competencies are required by core abilities that nurse needs to fulfill a nursing job. First, we have communication. Communication, we have to have an effective patient care and interpersonal skills. And communication will bring this change. We need to embrace change, skills, attitudes, beliefs. If we're wrong, if we don't know something, we need to embrace any changes, any technological advances, any medical advances. Professionalism. Nurses need to, and every medical professional needs to conduct with professionalism, and we need to have ethics, moral values, judgment, nursing judgment, professional judgment. Um, the other one is evidence-based practice. We need to conduct our nursing practice, our medical practice, on the current and best evidence that clinical expertise and clinical practice has in patient care. Resources. We need to be resourceful and keep on mind of our resources that we have available to provide better patient care and or to be a better nurse. We have mentors, supervisors, directors, educational practices, that can be services like literature, nursing educators. We need to use our resources that we have available, uh, to be a competent nurse. Knowledge. Our knowledge is never gonna stop growing. Knowledge we acquired through experiences, through nursing school, continuation of education like the BSN, MSN, PhD, technological advancements. So knowledge, it's what never stops growing, and it's never enough. Knowledge is There's no limit for knowledge. Um, and if we take a closer look to these elements, all these elements are surrounding or by leadership. And I believe leadership is a element that not all nurses have. Um, it's Leadership is something that it's given, or you need to like to be a leader too, and be a good leader. Um, this element is one of all the elements that it's the glue for all the elements, in order to make them function and apply them in the patient care practice. So leadership can help with communication, charge, professionalism, evidence, research, and knowledge. Education and teaching plan. What are we gonna do? What tools do we need to educate and teach the patient regarding their medications? What is gonna work for them? What education and teaching plan? Is either we're gonna do it in English and Spanish. So we need to have a plan on how we're gonna teach and educate the patients. One thing that I believe it's a really good resource, and it's a really good teaching tool. It's the medication log sheet. This medication log sheet it's a list that can summarize the patient's medications in a general aspect of the medications, including of the medications and the prescriptions, including the over-the-counter medications. So the creation of a medication log sheet that a patient can have and can research to whenever it's needed or whenever something happens. It's a good it's a good tool, and it's a good tool to have and to show to other medical professionals on other doctor specialties, um, or specialists that the patient goes to, so they can be aware of which medications the patient is taking. So our medication list can include name, age, date of birth, allergies, doctors, medications, and within the medications, we need to include the dosage, the frequency, administration route, medicine specifications, and we need to include the over-the-counter medications, or any not only the over-the-counter medications. We need to include any teas, any supplements, any remedies, any herbal remedies that the patient may take. Um, in case anything happens, we have the patient was taking this or is taking this. So the a great tool, educational and teaching tool, in my opinion, it's a creation on a medication log sheet that the patient can understand and can follow and can show to their medical professionals or their healthcare providers. Individual medication log sheet. This list, it's another sheet that can summarize each medicine individually for the patient to reference the general aspect of each medication. And in this list, the nurses will assist, educate, and teach the patients, family members, or caregivers how they are involved in the patient medication management and medication organization. So in this list, we can have each medication that the patient takes, and we can have the medication, the allergies, the doctor who ordered that medication, what's the specialty of that doctor, the medication summary, for example, like the medication, the dosage, the frequency, how the patient takes the medication. And on the bottom part, we can have medication specifications that the we can have the medication specifications that the patient can reference and be aware of its side effects, adverse effects, what to check before taking the medication, how to take the medication, when to hold the medication and call the physician, how to store the medicine, observations, comments, questions to the doctor or to the pharmacist. By the patient creating this to list and doing this to list and having it on hand and use them, it can create participation, and it can create knowledge of the medications that the patient is taking. Another thing that is good educational tool, it's tips for medication management and organization. For more tips and information and questions, it's important to encourage the patient that don't hesitate to ask a healthcare provider about the medication organization and safety medication disposal as well. It is important for patients to clean their areas where they have their medications, their pill organizers. They have to be clean too. How they organize the medicines, how the cabinets are organized and clean. These tips are helpful and for patients to manage the medications at home. Teaching tips, teaching tools, and teaching things that it can include. It's we can show the patient, okay, so tell me where you're gonna store your medications, and we can, help them organize and help them, give them tips that, make sure that your medications are current, that they're not expired. And if they're expired, we need to dispose all expired medications and teach them how to dispose the medications. um, and we can either do it interactive, or we can show them pictures like this ones, so they can have a more uh, clear idea on how to do it. Healthy, independent, joyful, free living. This is how the geriatric individuals should live their life to the fullest. Healthy, independent, joyful, and free living. Medical professionals and healthcare workers can help the elderly individual to achieve health, independency, joy free life, to do the things that they love. And thank you for attending to my presentation. I enjoyed this topic because I love to work and care for the elderly population. It's my preferred specialty, the elderly, the geriatric individuals, um, because they're like little kids. They're like big little kids, and they never stop surprising me, and they never stop um, being joyful, and being attentive, and being needed. They always this type of individuals, sometimes with a smile, with 5 minute talk, you make their day. Especially in the geriatric individuals that live uh, alone, or they don't have family members, or their family members, they don't frequent them, either in a hospital, as assist living, skilled nursing facility, or even at home. These individuals, they're vulnerable. They need help. They need teaching. They need education. They need, besides that, they need reinforcement, so they can live their life uh, uh, healthy, healthy in their best way possible, obviously, and so they can live a safe and comfortable life, and a life with healthcare, and a life with joy. So thank you for listening to me, and listen to this presentation, um, that I love research, and reading, and performing, and gather all this information and data. And this topic needs more, and in my opinion, needs more attention from medical professionals, from the healthcare system. We need more programs, not more medication education, and teaching programs for people, not only in English but in Spanish too, because we have a quite big Hispanic elderly community that only speaks Spanish. So this educational program and tools, they have to be in Spanish too, so we can help them and understand, and they can manage their medications at home safely. Um, Thank you very much.